with memory loss, Toastmaster Vishal.
Sorry to interrupt, just a small correction on the timing. Red card at 20 minutes. Rest is fine. How are you all? Good. Okay. How many of you here have forgotten your spouse's birthdays? Okay, great. How many of you have forgotten your ATM pin? Ah, great. Are these two occasions very dangerous?
One is very dangerous.
Conditions apply. Okay. Is it common? Is it expected? Yes, no?
Maybe.
Maybe. Okay. That's the right way to put it. Maybe. But today we are going to talk about memory loss or forgetfulness in a different way. Specifically with elderly. So, as a part of this talk, we'll be covering various aspects. We'll start with the beginning as to what exactly is memory loss. We'll cover the clinical aspects. We'll talk a bit on the treatment. We'll talk about how we care for the elderly having such issues. And at the end of the session, we'll also have a question and answer round, where I'll be taking all your queries. Having said that, if there is any query which you want to be answered immediately, you always have the freedom to raise your hand and I'll take it. Since it's a very important topic, I want all of us to go together. It's a deal? Are you all with me?
Yes.
Thank you. Okay. So now, what exactly is memory? Memory is basically, can I say that it's the ability of a human being to recall any information? Can I say? So if I am not able to recall this memory or recall this information, I'll say it's a memory loss. Okay. Now at the introduction, I asked you a few examples. Like you have forgotten something, somebody's birthday, somebody's ATM pin. So it's more like an ad hoc memory loss. So let's not worry more about it. Our primary kinds of memory loss are, one is related to aging. As people grow old, the efficacy of the organs go down, and which could lead to memory loss. Like for example, my great grandmother always used to forget that Ramayana comes at 8 a.m. in the morning, but she always comes in front of the TV at 7:30 a.m. Vishal, switch on the TV, Ramayana. Vishal, switch on the TV, Ramayana. And the next kind of memory loss is acute memory loss. And the third one is a progressive memory loss. We will be discussing more on point 2 and point 3 because that is our main area of concern. So what exactly is acute memory loss? So before we talk of acute memory loss, let's understand what is the meaning of acute. Acute in general means something which happens fast or something which happens all of a sudden. But in this context, it could also mean that something which is happening fast and something which is not progressing. So acute memory loss, in simple terms, it's a stage or it's a phase wherein there is memory loss which has occurred all of a sudden, but it isn't progressing. In other words, this is called as amnesia. I am sure all of you have seen daily serials, mega serials. You would have come across this old lady, she is walking, a lamp falls on top of her head. She faints, she gets up and she says, "मैं कहाँ हूँ? क्या हुआ?" Something like this is amnesia. But the thing here is, with amnesia, a bit of your information recall, that is memory is affected, but not your intelligence. It doesn't impact other phases of life. And most of the cases, this can be reversed. This might not have to be a lifelong suffering. Now the third one, sorry, next one is a progressive memory loss. This is, let's say, the most dangerous kind of a memory loss, because there is no end to how bad the impact can be. This could also be an indication of a concern in the brain, a degeneration in the brain. This would indicate something called as dementia. So if you see here, so dementia is a term used to describe a group of symptoms affecting memory, thinking and social abilities. Unlike acute memory loss where it only affects information recall, dementia impact would be more wide. It could impact your thinking, your memory and your movements. Symptoms could range from difficulty in finding the right word to concentrating on a task. It's like you want to say something, you are not able to find the right word. You are trying to read a book, but within few minutes you move on to a different thing. And some cases it may even happen that you have turned on the gas knob, you have not hit the lighter, and you come out of the kitchen. So the impact of a progressive memory loss could be wide. So what are the causes of memory loss? So one of the causes I told, it's age related. So there is little we can do about it, because as people get old, they face this concern. But the thing how we can help them is to be patient with them. They forget things, repeat it. They make the same mistake again, make them mistake. Because there is no other way to help such people. So the next thing is underlying medical conditions. Certain infections in the brain can lead to a memory loss. Tumors can lead to a memory loss. Other neuro diseases like a Parkinson disease, a dementia disease or a cardiovascular disease could lead to a memory loss. And there are conditions wherein there is lack of oxygen supply in the body and hence lack of oxygen supply to the brain. That could also lead to a memory loss. The next one, lifestyle factors. This isn't a direct contributor, this is more like an indirect contributor. In certain cases, a vitamin imbalance, a sodium imbalance can also lead to a memory loss. If you have a healthy lifestyle, we can address it in a better way. Chemotherapy, which is a known treatment for cancer. Many people who undergo chemotherapy complain of memory loss. And the other cases is there is a group of painkillers, antihypertensive drugs, which can lead to phases of hallucinations or temporary memory loss. And alcohol. You know better what happens with excessive consumption of alcohol. So here I'd like to share a small story. So one of my friend, he uses his Sunday to drink. I told him one day, bro, don't drink in excess, drink in moderation. And all of a sudden, a wave of patriotism and nationalism ignited. Bro, I'm a responsible taxpayer. It's only because I pay taxes, Karnataka is getting its bhagyas. So that the needy get the bhagyas, I'm compromising my health and I'm doing my share of contributions. Okay? On a serious note, there are better ways to contribute to the government rather than indulging in alcohol or such substances. Are you all with me?
Yes.
Thank you. Okay. So now how do we know that a person has such issues? Because it's common that we forget ATM pin, we forget somebody's birthday, we forget somebody's phone number. But when is the time that it gets serious? So repetitive forgetfulness. Somebody who is in 80s or 90s, it's a different story. But somebody who is in the 50s, forgetting repeatedly. it's a sign of concern. It could even be as such that I've had my breakfast now. After 10 minutes, I again go to the kitchen and try to have another round of breakfast. Difficulty with daily tasks. It could be as simple as tying your hair to buttoning your shirts. Confusion. You are not sure where you are. You are always in a panic situation and you don't know how to react. Behavioral changes. So why this happens is, many cases, people who have such issues don't know how to respond. They forget that for such situation, I have to be happy. For such a situation, I have to be sad. And I have to be angry. So they don't know how they have to react, and more or less they are not in control of their emotions. And communication problems. They don't know how to end a sentence. They might not be able to respond with the same empathy the first responder question, or they may not be able to find the right words. So now that we know what are the symptoms, how exactly we care for them? What are the treatment options? So basically, first is a medical treatment, which is a combination of your medications. So here the thing to remember is, we are trying to identify the root cause of memory loss. There is no miracle pill that you take this tablet, your lost memory will come. You need to identify the root cause of a memory loss. Whether it's because of some issue in the brain, whether it's because of a stroke, whether it's because of some trauma. And based on that, related medications are available. So the next is cognitive therapy. So what exactly is cognition is? It's the ability of the brain to understand and to take decisions. So people who have such issues have a problem in taking decisions and reacting. So cognitive therapy is conducted by psychotherapists. So they try to train the sufferers on how to lead a daily life, on how to manage their daily activities. And a non-medical treatment, a healthy diet with good vitamins, non-anti-inflammatory foods, removal of junk food. This doesn't reverse memory loss, but it makes sure that the progression is slower. Fun games, it's a good way for the sufferers to engage in stimulating activities. Physical activity, good amount of walking. People who can do physio, let them do physio. People who can do aerobics, they can do aerobics. So overall, the treatment would be a combination of both medical and non-medical. Now, how do we care for them? This is not from a medical perspective, this is from a sufferer's family perspective. So, safety measures. What I mean by safety measure is, what are the changes you would need in a home? It's preferable that the room where these people are staying is well ventilated and well lighted. Too much of darkness can induce mood changes and can aggravate depression. And at places people have tremors or walking issues, they can have walking support or permanent handbars. And it is also possible that some area of the home be color coded. Like gas stove is something they should not touch, color coded with a red color sticker. So the psychotherapist will train them. Wherever you see red, you should not go near it. And declutter your furniture. They might not be aware of where things are, so you don't want them to trip inadvertently. And the next thing is emergency contacts. People who are in a nascent phase of a memory loss, they can do most of their activities on their own. But it's always good to be prepared for the worst. Assume there is a person who has initial stages of memory issues, but he wants to do things on his own. It's not good that somebody from his family or a caretaker walks and piggybacks. So, but what are the precautions we can take is, you can have a card about his condition, about the address, about the emergency contacts. And today is the world where we have mobile phones. install a GPS tracker. And the daily care tips, how can we take care of them? Ensure food is taken on time, medications are taken on time. Have a medical organizer like this. Many people, they have to take tablets 4 to 5 times a day, which is like 30 to 15 tablets. So if you can divide it morning, afternoon, evening, night. So something like this will help them stick to their routine. Effective communication. Don't use slangs. Don't tell Isala cup number. They won't understand. Tell Isala RCB gelbodu. This time RCB may win. Okay? Avoid usage of slangs. And most important, answer to them with patience. Assume that these are not old people, these are kids. Like how we would take care of small kids, we should take care of them as well. Thanks to WhatsApp, you can have unlimited video calls. Try to schedule regular video calls. And try to take feedback from your relatives or friends as to how they are interacting. Because the primary caregiver sees them day in, day out. They may not be able to understand the changes in their behavior. Okay, professional care. People have too much of dependence. They can't do things on their own. There are caretakers available who are as good as a nurse. And we need them if there is a higher level of medical care required, wherein the primary care is not sufficient. And the next one is daycare centers or a nursing home, which is completely like a mini hospital or effectively a hospital. So now, is this a major issue what we are talking about? Yes. Okay, let's say there are 80 lakhs Indians who have the memory related issues. It could double in the next couple of decades. And people who have lifestyle issues like diabetes, hypertension are at major risk. Today, India's population is a young population. After 2 decades, today's youngsters become tomorrow's elderly or middle-aged or old age. So if we don't track and take care of this now, we will be in a soup after 2 decades. Where it might not be a tameable problem. On talking of what is this ARDSI, it's Alzheimer related disorders Society of India. Is it only common people that face this? No. Seema Anand from the famous movie Kora Kagas and Anand. She passed away due to Alzheimer's and dementia. Any idea who is this? Oh, great. Okay. He was also a victim of Alzheimer's. Do you think these are all the only celebrities that have that issues? There will be more. And the reason I told is this a serious issue was, the reason I have this a serious issue is, in India, mental health is considered a taboo. We don't want to reveal what is wrong with our mind. So similarly, if we don't want to reveal our depression status, we don't want to reveal our memory issues. So most of the cases, whatever we have, people say it's widely underreported and underdiagnosed. So having said all this, is there a way to prevent it? We can to a major extent by having a good diet, by exercising regularly, by getting good sleep, by managing stress and taking care of your primary health, controlling cardiovascular issues. Why this is important is, people who tend to have heart attacks have a susceptibility of lesser oxygen supply to the brain. Avoid harmful substances, keep your brain active, and social engagement. Best thing is join Toastmasters. Okay? So now the thing here is, if you ask me, Vishal, by following all this, won't we have memory loss? We may not, but the impact may be less, or the inevitable may be less. Because memory loss could also be a reason of genetics. Okay. Now, if there is any question that you want me to answer, we can do that.
Why did you choose this particular topic?
Okay. So one thing is it's about the intensity of the topic. I know a couple of friends in the personal lives wherein they tell that the people who are having these issues, they get very aggressive. They hit people. Caregivers can't manage. And at the same time, my father has also developed such issues recently, so I wanted to highlight this. Any other question?
As a person who will be taking care of someone going through memory loss, how can you take care of yourself in turn? Because it can be frustrating at times.
Yeah, a very good question. It will be frustrating. We feel that there is no hope. We feel that there is no hope, but the only option is to take it one day at a time. Because you know that things can't reverse, but the best thing is, what's in your hand is you don't let the things progress. Okay. So we are running out of time. Before we end, a small quote. Memory is a way of holding on to the things you love, the things you are, the things you never want to lose. Just imagine this quote from the person who has memory loss issues. They don't have anything to hold on, they don't have anything to love, and they don't know what they are going to lose because they are not aware of anything. Okay? Thank you.